As many as 1 in 4 American adults experience some form of carotid artery blockage, which in extreme cases can lead to stroke or heart attack. A new study led by University of Michigan Dr. Hitinder Gurm suggests that 2 different carotid artery procedures give similar benefit to stroke prevention.
The carotid arteries are the main arteries to the brain. The brain has 4 arteries. There are 2 carotid arteries, one on either side, and 2 vertebral arteries that go in the back. The carotid artery supplies most of the blood to that side of the brain. We treat carotid artery blockages for 2 reasons. One is in patients who've had mini strokes. They have a very high risk of stroke in the immediate next 6 months. So these patients are called symptomatic carotids, and these need treatment done on a fairly urgent basis. There are other patients who are asymptomatic, who have not had any symptoms, and these patients need treatment to prevent future stroke. The gold standard treatment is carotid endarterectomy. This is a surgical treatment where a surgeon makes an incision in the neck and cleans out the plaque and sutures it up. A newer option for carotid blockages is stenting. Stenting is a less invasive procedure. It is done through a puncture usually in the groin, sometimes from the arm, and does not require general anesthesia. This multi-center trial, which had investigators from University of Michigan, Harvard, Cleveland Clinic, and many other institutions, randomized about 300 patients to either get stenting or endarterectomy. These patients were all considered high risk for surgery. So these were not the average patients, but the patients who were felt to be at high risk from complications when they would undergo carotid surgery. These patients were then followed for 3 years, and we looked at their outcome to see if the long-term protection from the risk of stroke was any different between those who got stents and compared them to those who got surgery. In this study, we found there was no difference in outcome of these patients with respect to their total survival or the risk of stroke. So overall, although this is the first study, we did not find a difference to say one strategy is superior to the other as far as the long-term outcome goes. One thing which is important is that when patients undergo surgery or stenting, it's important that they make sure that the operator and the institution does a lot of that, because there's a clearly relationship between the number of cases an operator does or the institution does and the outcome.